In our medical news, about 600 CDC employees were notified of permanent layoffs this week. About 2,400 workers were initially terminated. You may remember back in April, but a federal judge ordered hundreds reinstated. The Department of Health and Human Services says reducing CDC staff will make the agency more efficient. And the Supreme Court handing President Trump a temporary win in his fight against federal diversity funding. Yesterday, the justices ruled to let the administration block nearly $800 million in research grants that officials say involve race and gender issues. The decision divided the court with a narrow 5-4. More than 15 million Americans are using weight loss drugs like Ozempic and Wegovy, but experts warn you could lose more than just fat. Mandy Gaither has the exercises that are critical if you're on one of those medications.
They've become an important weapon in the battle against obesity. GLP-1 medications can lead to significant weight loss, but experts warn the number on the scale can't decipher between fat and muscle.
The key to weight loss, and especially weight loss maintenance, is always going to be diet and exercise.
It's unclear how much muscle a patient on these drugs may lose, but studies have indicated anywhere from 15 to 60% of the lost weight is lean muscle mass, meaning if you shed 50 pounds, you'll potentially be losing 7.5 to 30 pounds of lean muscle. That's why strength and resistance training is crucial, says Cleveland Clinic Dr. Paminda Kabandugama.
Things like free weights, things like the weight machines help. In a lot of my patients who might be a little bit older, I do recommend things like water exercises.
Every week, Kabandugama says all adults should aim for 150 minutes of moderate intensity activity like a brisk walk, water aerobics, pushing a lawnmower, or playing a sport like doubles tennis. The CDC says you could also do 75 minutes of vigorous activity each week. That could include jogging or running, swimming laps, or playing basketball. Kabandugama says protein is also key to building muscle. On average, he recommends about 35 grams of protein with every meal.
We want them to make sure that, they are still preserving muscle or even maybe gaining a little bit of muscle while they are technically losing weight.
Doctors say it's also important to stay hydrated. Drinking plenty of water not only helps with appetite control, it also plays a role in helping the kidneys process all that protein.